Hi. Today we will talk about thoracentesis. Here from the Skills Lab in University of Missouri, Kansas City, we'll do some education video about how to do thoracentesis. And the first thing for any procedure to start with is the checklist. So this is our checklist for thoracentesis. And first thing, we talk about consent. As we talked before in consent and previous procedures, consent should be taken by somebody who's experienced in the procedure, because you need to tell the patient all that the patient wants to know. Patient may ask you how many procedures you did before. So if you tell him I did 1 or 2, he may not give you a consent. If I tell him I did 15, 20, 50, 100, then more likely to give you the consent. Also, patient needs to know if there is any alternative. You need to tell them if there's any alternative to the procedure, and they can pick if there is any alternative, which one they prefer. And also, patient needs to know what you will do exactly, and needs to know what are the possible complications that may happen, and what will you do when you get any of these complications. So consent has 3 rules. First rule, be nice to the patient, confident in yourself, and the third rule, don't scare the patient about complications. So if you tell the patient how rare the complications are in reality, and also what will you do if any of these complications happen, patient is more likely to give you the consent. Next step is to do the timeout. And timeout is patient name, patient birthday, and also something like the thoracentesis. You need to know in the timeout to tell what procedure you are doing, and also because we have right lung and left lung, you need to tell which side you are doing. So you need to mark the site. If you are doing left side, mark the left side and put your initials and the date of the day. This is a requirement. So if you are doing a procedure that has 2 sides, so you don't skip the side that you want to do and do it on the opposite side, and you need to mark the side on the chest, back of the chest, and initial your initials and date of the day. So this is how you do the timeout. Also need to check with the patient if he has any side effects. So we are using lidocaine here for this procedure. If he had any side effects of lidocaine before, you need to know that, and in this condition, you shouldn't use it. Okay, so after that, the position. Very common position that we prefer to do thoracentesis is like this mannequin. So patient is sitting on the bed with legs down, a table in front of him. He puts his arms on the table and leans a little bit forward. Patient should be comfortable. They may stay in this position for 30 minutes. I usually ask them if they want to go to the bathroom before you do the procedure, so patient doesn't feel the urge with the stress of the procedure that they want to go to the bathroom in the middle of the procedure. So this is one important thing. So this is the position that we do the thoracentesis. Then we will look with our ultrasound. So when we look with the ultrasound, before we get sterile, this mannequin has a better ultrasound view, and I will show you what we are expecting to see when we are doing the thoracentesis. So you see this green dot here. This should be towards the head of the patient. So this green dot on the ultrasound screen should be towards the head of the patient. So when I put my probe, this is my knob where the green dot is. So this knob should be towards the head of the patient. Then I will see this view. I'll show you on this paper, then I will show it to you on the mannequin. So what I will see, patient head will be here, and patient legs will be here, and this is your diaphragm. Here is where your probe, here is the skin, and this is your fluid. This is how your fluid will look like, black fluid. And above the diaphragm, because we said head is here, below the diaphragm here, this is right side, so you'll have the liver. If you are on the left side, you'll have the spleen, and this is your collapsed lung. Here is your ribs. These are the ribs. You should see some black shadow from the ribs. And also, you need to pick the position above the diaphragm and below the lung. This is a very good spot. You can go here to get this fluid. You should measure the depth from the fluid from the skin to the fluid, how deep you will need to go with your needle. Before you start, you know, I go 3 centimeters and I will get fluid. So when you go with your needle 3 centimeters, you should get fluid. So this is very important. One important thing, if you shouldn't have the lung in your way. So I may ask the patient also to take a deep breath. Sometimes patients sigh or take a deep breath in the middle of the procedure when you are going with your needle. You want to be sure this spot where I will go, when the patient takes a deep breath, he will not bring the lung to the needle spot. So this is what you will see. So head here, legs here, your probe is here, it should be your internal organs here. This is your white line, curved line is your diaphragm. Below it will be the liver on the right, spleen on the left, and this is how the lung, the collapsed lung will look like. This fluid looks very clearly black, water is black, so this tells you that this is a free-flowing fluid, is not complicated effusion. So this will be easy to get. Let me show you on the mannequin, and now you will concentrate on the screen. This is my probe. Ultrasound likes two things. Ultrasound likes two things. One is a lot of gel. Two is perpendicular to the organ that you are looking at. It doesn't like two things, bone and air. So if you have air, you will see the screen very unclear. If you have bone in the way, you will see the bone shadow. And this is what we will see here. Let's look at the screen here. And when I put my probe here, I will try to find my diaphragm. Here or on the back for the other mannequin, this mannequin here, we can look on the back. And you need to screen your place if your patient has loculated effusion to find what's the best spot to go. If I look here, if I see there, this looks like my lung. Here is my lung, looks like tongue shaped. This is my probe skin here. This white line is pleura. This white curved thing looks like inverted V is my rib and has a black shadow beyond it. If I go up a little bit, you see the lung here, the pleura here, there's a little bit of black fluid there. If I go there, I may hit the lung, so it's not a good spot. So now I'll try to find, go down, try to find my diaphragm. And here is my white line diaphragm. So this is my diaphragm, and below it here will be the liver on the right, the spleen on the left. This is my lung, and this is my rib, and this is a good space probably to go, is to go here with my needle below the lung and above the diaphragm. Once I find a good spot, I can mark it. You see my probe, my knob, where is the marker, is towards the patient head. So head here, legs here, this is the lung. If I go down a little bit more, this is white line here, is my diaphragm, and the liver is below it. If I look here, this would be a good spot to go below the lung and above the diaphragm. Once I mark the area, you need to mark it, then you need to get ready to do the procedure.